In an effort to streamline our process and to limit the amount of confusion between federal eligibility guidelines and state eligibility guidelines, and to coordinate with the feds, we're announcing that educators, early educators, and school staff will be eligible to begin signing up for vaccine appointments starting on March 11th,
Yes.
which is next week.
Sorry. Sorry.
For the record, my good friend, the mayor of Gloucester, managed to go almost 15 minutes without saying something, which, for those of you who know her well,
That's a lot.
I'm really impressed with your discipline this morning, Mayor.
I love the teachers. I'm
Yes,
sorry.
I know. When appointments are released next week on Thursday, K through 12 teachers, child care workers, and school staff will be eligible to sign up at all 170 vaccination sites that are open to all eligible residents around the Commonwealth. Additionally, the command center will designate specific days at mass vaccination sites for educators to get their shots, and we'll have more details on that as we work them out. This group of workers consists all in of about 400,000 people, which means another 400,000 residents will become eligible to book appointments starting on March 11th. They'll join several of the other currently eligible groups, including everybody over the age of 65 and the folks with 2 or more certain health conditions who've been working their way through the system for the past couple of weeks. The 65-plus group and the 2 health conditions group, between them, represent about 1 million residents. So far, we've received enough vaccine to vaccinate so far 1/3 of the folks in that category. The math on this is pretty straightforward. If we add 11 million or 400,000 people on March 11th to the eligible pool, that'll mean we'll be back to having about 1 million people who are eligible to receive a vaccine. And as I said, we currently get about 150,000 first doses per week from the federal government. The message governors got yesterday is that we should not expect a significant increase in supply until the end of March. Therefore, it will probably take a while for all the folks who are part of this eligibility group to work their way through the system. Our estimates would be first dose appointments would probably start to cover pretty much everybody in that group about a month after they're eligible.